here to discuss with all the colleagues well round about my presentation. This is the paper that I published in 2015 on the effects of perinatal meditation on pregnant Chinese women in Hong Kong. It's a randomized controlled trial. This is the reason why I do the trial, because the pregnant woman is preparing two births, her babies and her own rebirth. And so this is very important about the problem of maternal health and the fetal health. The study background is psychoeducation and pregnancy health are interrelated. Childbearing is the ideal context within which to enrich health. And perinatal meditation is important in facilitating health, and pregnancy health has been shown to have significant consequences for the mother, growing fetus, child, and family. Pregnancy is a biopsychosocial-spiritual model. And there's many research which published that the symptoms of pregnancy are closely related to stress, including physical health concerns and psychological stress. And with well-known published data about the stress birth outcome, if we have stress during pregnancy, this is a biopsychosocial model, and this will increase risk of preterm labor. And why we have such consequences is because stress will affect the physiological mechanism, affects the nervous, endocrine, and immuno pathway. Because we know that there's a lot of stress. When you have stress, there's a lot of hormones that will produce what we call a group of stress hormone. And all these stress hormones will affect the behavioral mechanisms and will also affect the health-related behavior. And we know that even not pregnant, stress will affect the poor eating habits, smoking, alcohol, and drug abuse. And what is the effect of meditation on pregnancy? Because pregnancy is a biopsychosocial spiritual model. And now we have lots of study. We confirm that for perinatal meditation, we will improve the minor ailments of pregnancy, decrease the chance of unwanted pregnancy, and enhance and decrease the perinatal emotional problems and also unexpected birth outcome. And even with complications of pregnancy like preeclampsia, preterm birth, and large for gestation age, we have effects on, if we're doing perinatal meditation, we have decreased this kind of complication. And there are now research which confirm that there's enhanced fetal health, decrease the possibility of neonatal complication, and improve child health and family health because of the improvement of the maternal health and fetal health. So, and now we relate to the present contents of prenatal care is, of course, we have antenatal visit, we have prenatal diagnostic clinic, we have combined medical clinic, we have antenatal classes, we have postnatal visit, we have postnatal classes, but we have no psycho intervention incorporated into our routine antenatal care. So there's a research gap here. There's a limited study on meditation and on maternal health and fetal health. So my research is to explore the effect of meditation in pregnancy health, fetal health, and future child health. As there's narrow choice of perinatal meditation available, I developed an Eastern-based meditation intervention for the pregnant Chinese woman in Hong Kong and evaluates its impact on pregnancy health, fetal health, and child health. So the conceptual framework of the study was based on the postulation that there are positive relationship between meditation and pregnancy health and fetal health. And the Eastern-based meditative intervention developed was based on the positive effect of psychoeducation, cognitive intervention, mindfulness practice, and the 4 immeasurables meditation on health. So the first perinatal meditation intervention that taught the pregnant mother is to practice mindful eating. It's chewing slowly, aware the motion of your tongue, paying attention to what you can taste. The effect is good, not even on psychological, but also is on the minor ailments, because the pregnant lady always have bowel problem, always have regurgitation, nausea and vomiting. And for practice mindful eating, it can improve this kind of symptoms. The another mindful intervention is mindful walking. What means by mindful walking, as difference from the normal exercise, is you paying attention to the experience of walking itself, to the sensation in your feet, and being aware of your movement. And through mindful walking, not just as an exercise that you can do during your pregnant, because there are few exercises that you can do during pregnancy, but also have the effect on psychological. And through the psychological effect, we have to improve the maternal effect. And through improving the maternal effect, it will improve the fetal effect, and so in fact improve the fetal child health. And also we can use the mindful intervention, add on the antenatal and postnatal exercise. So just awareness of your body motion, keep slow in action, don't force yourself to the extreme posture, and maintain attention on the rhythm of breathing. Another, what you can practice is mindful breathing. The mindful breathing is you can practice anywhere, not just in the sitting position or the meditative position. You just keep erect, but keep on a comfortable sitting posture. And also you can practice mindful breathing while you're standing. The main attention is to maintain the attention on the rhythm of breathing. This is the main theme about what you have during the mindful breathing. And another aspect about the Eastern-based meditative intervention, I can teach the pregnant lady to have some daily practice which are attached to your daily life. And through this kind of practice, you can cultivate your loving kindness emotion, cultivation of compassion, cultivation of empathetic joy, cultivation of equanimity, and cultivation of altruism. The daily practice of Eastern-based meditative intervention about the cultivation of mindfulness, of living kindness, is the daily practice of self-help, helping others. The cultivation of compassion and impermanence is the cognitive preparation for the worst, empowerment of the turn curse into blessing. Cultivation of appreciative joy, appreciation of life, and pregnancy life, and your pregnancy happiness is the daily practice of bliss. And equanimity is the idea of let go and the action of put it down when you are facing any difficulty, both emotional and physical, during your pregnancy period. So this is what summarize about the Eastern-based meditation and about the psychoeducation, what is the effect. And the content of the Eastern-based meditative intervention is not just what previously I tell, is increasing mindful eating, mindful walking, mindful prenatal and postnatal exercise, daily practice of self-help, helping others, crisis intervention, turn curses into blessing, daily practice of bliss, let go, 3 minutes breathing practice, body scan, mindful breathing, and the 4 immeasurable meditation. So there's all items, and you can choose not doing all. You can just practice some is enough, because this is so from my quantitative research. About this research is a quantitative, is an intervention research. The research conducted is since 2007 till 2009, and they are from the private sector and obstetric unit of Queen Elizabeth Hospital in Hong Kong. And the pregnant women are randomized in 2 groups. One is the intervention group, and the other is control group. And we have the questionnaire study. In the first visit, 36 weeks, 6 weeks, and 5 weeks postpartum. And also we do the salivary samples for cortisol during the first visit, 36 visit, and 6 weeks and 5th month after delivery, and also a cord butt for the cortisol level and the salivary cortisol level for the infants at 6 weeks and 5th month. I have conducted 7 classes of this meditative Eastern-based meditative intervention, and 64 pregnant ladies were recruited for the intervention. 559 pregnant Chinese women were recruited for the control. And the time zone for the data analysis is the baseline is around 20 week to 24 week. It's the second trimester. And the time zone for the data analysis, the second is around 36 week gestation. The time zone for the 3rd time zone for the data analysis is around 5th week postpartum. And the 4th one is around 5th month after delivery. So I say this 11 items about the Eastern-based meditative intervention, and I divided them into the frequent practice group and also the not frequent practice group. And in the frequent practice group, there are 36 persons, and in the not frequent practice group, there are 22 persons. And we are using, first is the statistics significant data. The first is from the prenatal cupping inventory. We found that there's statistical significance on the improvement of the positive affiliation on the pregnant lady. And also from the salivary cortisol level, we also have a positive effect for those who practice the intervention. And this very good statistical finding is that for those who practice intervention, their physical distress during the postpartum period is better than those of the control group. So the present study recommends that pregnant care provider should provide spiritual care and perinatal care to a pregnant woman. And the Eastern-based meditative intervention developed at the present study can be included into the prenatal care system. And the implication for the incorporation of the Eastern-based medical intervention can improve problems in pregnancy like intrauterine growth retardation, hypertension, complication pregnancy, and psychological problem during pregnancy, because all these complications may have a stress component. And the present research also indicated the importance of positive health indicator, because we are not much positive health indicator at the present, because all our research is based on sickness and problems, but not on the result of the intervention on the positive health. So I recommended more research in this area. And the conclusion is that from the study, I find that the frequency of practice of meditation is directly related to its effect. Perinatal meditation can help pregnant women to reduce perinatal stress through its effect on coping mechanism and improves physical discomfort in postnatal period, which are risk factor for maternal health, fetal health, and child health. Perinatal meditation can be added into present perinatal counseling and perinatal program to promote maternal health, child health, and family health. There are also related research from this research. One is the perception and experience of the pregnant Chinese woman in Hong Kong on this kind of prenatal meditation. This is a qualitative study, and was published in 2015. And the other effect probably is the first worldwide paper on the effects of perinatal meditation on pregnant Chinese women in Hong Kong. Is the randomized control, is the just effect, is the just paper that I just present. And about the detail, you can go to the Hong Kong University about the thesis, my thesis, which is the spirituality and psychoeducation of pregnant Chinese women in Hong Kong, and evaluation of the effect of an Eastern-based meditative intervention on maternal and fetal health status. So this ends my presentation.
Thank you so very much for that excellent presentation.